This is Nyeri's healthcare workforce. With all 600 of them on the street, public hospitals in the county, including this biggest referral facility in the region, remain locked and inaccessible to the public as well. This has been the situation for the past 3 weeks. Some patients have died for lack of that crucial service.
We really have to open the hospitals. We cannot afford, to just have all that suffering going on. And that is why I said that if you indeed do not report back to work, then we have no alternative but to employ others to come in and render service. And we did place an advertisement. It is in today's newspaper, to employ people across the various countries so that we have service start in our hospitals.
But late into the evening, the entire workforce stood its ground. No one was willing to go back to hospital just yet.
I've heard our positions have been advertised. That is illegal because we are not employed by the county government of Nyeri. We are employed by the Public Service Commission. And so they have no right to sack us.
As we are talking now, I've just been informed that the court has actually now issued a new order that these nurses must report to work immediately. So we will be monitoring to see whether by 2 o'clock today, whether they have actually reported. And if they do report, what the court has said that if they indeed do report by today, then we can review the position and notify their positions, the ones that we already advertised. If they do not, then we go ahead. So the ball is here in their court.
From now on, we are going to consult so that we know the next move.
They were initially protesting the delay in salary payment. The county government says it cleared that debt by the 19th of August. The doctors and nurses also want promotions. The county government claims promotions en masse is unrealistic. The workforce further complained about lack of drugs and medical equipment. The county government is not convinced about this.
Again, that is another excuse, which I find very, very strange. And I'm saying this because this is information that I've gotten from KEMSA. Since the health sector came in under the county government, the procurement of drugs have gone up by 30%. And even in instances where we do not have drugs in the hospitals, it is because of the pilferage going on in the hospital by the same people who are striking. The clinical officers, the nurses, the doctors. There's a lot of malpractice going on in our health institutions, not just in Nyeri, across.
Is it that the health workforce wage bill is the biggest in your county and probably in other counties as well?
In Nyeri, we have a total wage bill of 2.6 billion.
Why so?
2.6 billion, which is about 60% of the entire budget in Nyeri. Out of that 60%, 40% is going to the nurses, the ones who are on strike. And prudence on any serious government is actually to try and downsize.
We had also raised an issue of shortage. So if they are employing because of that, as we have got no problem, but nobody should take our position.
If you look at some of these other advanced countries, people work. People show up for work at 8 o'clock, they work up to 5, and they give their worth. There is a culture that is also lacking in this country. People demanding salaries and not giving their employers the worth of what he is paying. That is something also that we need to improve as Kenyans.
Are you convinced that the county governments are handling the health function well?
Not only am I convinced, the Deputy President is on record saying to Kenyans and anybody who wants to hear that under the county governments, the health systems are running better than before.
For now, though, the striking workforce has not yet been served with a court order demanding their return to work. That means immunity for them over the weekend. But for patients, their immunity is further compromised in the absence of the much-needed treatment. Sylvia Chebet, Citizen Weekend.